Assalamu alaikum. In this video, we are going to discuss about the emphysema. Previously, we have discussed about the chronic bronchitis, but just see that there are two types of lung diseases. One are the obstructive lung diseases, and the other one are the restrictive lung diseases. Among the obstructive lung diseases comes the you can remember it from the mnemonic A, B, C, and E: asthma, bronchiectasis, chronic bronchitis, and emphysema. Obstructive lung diseases mean, suppose that this is your alveoli, okay, and suppose that this is another alveoli. In obstructive lung diseases, there is any obstruction like this, due to which air cannot go out. But in the case of restrictive lung diseases, there is restriction. It means any restriction due to which air cannot come into the lungs. Mark the difference between these two. As we are concerned with emphysema here, it is an obstructive lung disease. By definition, it is, just listen its definition carefully. In its definition, the whole morphology will be covered. It is permanent. It is permanent. I repeat, it is permanent. It is not reversible. It is permanent enlargement of air spaces distal to the terminal bronchioles, and moreover, it is accompanied by the destruction of their walls. Number third, that there is no significant fibrosis present here. Okay, in order to understand its definition, first understand the whole airway. Like the airway starts from this trachea, then this trachea divides into bronchi, and then it further divides into bronchioles, and then comes the terminal bronchioles, and then respiratory bronchioles, and then come the alveolar ducts, and various alveoli meet, just like the bunch of grapes are present. Just like the bunch of grapes, all the alveoli meet, a group of alveoli meet to form the alveolar sac seen here. After the terminal bronchioles is the conductive zone, and then comes the transitional and respiratory zone from respiratory bronchioles, and up to the alveolar sacs. And one more thing is that acinus, this whole structure is also called the acinus. Acinus is mainly the structure that is present distal to the terminal bronchioles. Just terminal bronchioles was up to this, and distal to the terminal bronchioles comes the acinus. This whole structure is your acinus, and 3 to 5 acinar together meet and they form one lobule. Okay, I hope so this will be clear. Here you can see, I'm repeating its definition. There is permanent enlargement of air spaces distal to the terminal bronchioles. This is terminal bronchioles. So in emphysema, there is permanent enlargement of air spaces distal to the terminal bronchioles. So we can say that in the acinus, dilatation occurs. Number two thing is that the destruction of the walls, alveolar walls, are destroyed in this case. And three thing is that there is no significant fibrosis. Here you can see, just like the bunch of flowers, you can see here this is the bunch of flowers. Like this, many alveoli together meet to form an alveolar sac. Okay, so here are two types. Here are four types of the emphysema. Okay, one is the Centriacinar emphysema. In Centriacinar emphysema, as its name indicates, here the only the proximal portion of the acinus is involved. It means like this respiratory bronchiole is involved. It is dilated mainly, and this portion, this distal portion, is paired in this case, and it commonly occurs in the cigarette smokers, and it mainly occurs in the upper lobes of the lungs. And then comes the Pan-acinar emphysema. It is also called pan-lobular emphysema. In this case, the whole acinus is involved. There is enlargement in the whole acinar. Like respiratory bronchioles are also involved, like alveolar duct and alveolus are also involved here. And number third is the distal acinar. In distal acinar, only the distal portions of the respiratory or acinus, mainly only distal portion of the acinus is involved, while this proximal portion is paired in this case. And distal acinar, we call this distal acinar as Para-Septal emphysema as well, because like this is one alveoli and this is the other alveolus, and these two alveoli are separated with the help of the septa. And this, like in this case, this is the alveolus. Okay, this is the alveolus, and here is the septa, and then comes another alveolus. Because in the distal acinar, only the distal portion, like these alveoli, are involved mainly, so it is also known as Para-Septal emphysema, as it is just close to this septum. And this mainly also occurs near the adjacent to the pleura. Like this is the lungs, and it is covered by the visceral pleura, and after that comes the parietal pleura. Between these two is the fluid. Okay, after that, just Look at its morphology. You can see here that in the case of its gross morphology, you can see, as its definition indicates, that it has enlarged air spaces. You can clearly see here enlargement of the air spaces present here. After that, this is another diagram of gross morphology where you can see that there is enlargement of the air spaces. Here, this is a picture of your big robins. Here you can see that this is the Centriacinar emphysema, where the whole lung parenchyma is not involved. Here is the only small portions involved here as indicated by the arrows, and the remaining portion is normal. But here, or the diffusely your lung is involved. Okay, there is increased number of air spaces diffusely, so it is called Pan-acinar emphysema. In the case of its microscopic morphology, first understand that some of the features that what a normal lung looks like in histology diagram. Here you can see that this is the alveolus, and this is your blood vessels or capillaries, and this is your bronchiole. This is another picture where you can see that this is the alveolus. Okay, just like here this was the alveolus, and then comes the alveolar type 2 cells are present here, and capillaries are also present here. Okay, so in the picture of emphysema, this is a picture of emphysema. Here you can see clearly that air spaces, there are enlargement of air spaces here, and the septa are also broken down here, and the septa freely floats into the other alveolus. Here's another picture of emphysema. Here you can also see that there is enlargement of the air spaces present here, and these are the septa. Here the septa are also broken down, and they are floating into the lumen of the alveolus. You can say that it is lumen of the alveolus. And one more thing, so in the microscopic morphology, you can say that there is enlargement of the air spaces. Number two is that there is no, as there are no areas of fibrosis seen in this picture. Number two is that there is no significant fibrosis. Number three is that, as I have shown you in the normal lung histology, that there were some areas of the that there were capillaries present or blood vessels present, but in the case of emphysema there is loss of the capillaries as well. Here the septa are also broken down, or you can also say that the septa are lost here. And number fifth feature is that elastic tissue is also lost from the septa. As septa are lost, so elastic tissue is present in the septa. Septa is made up of somewhat elastic tissues. Those elastic tissues are lost. That is why there is elastic coils on the walls of the alveoli are destroyed. So that those coils, what is the purpose of those coils? Like this is the alveolus. Okay, and in those septa, elastic tissues were responsible for the for maintaining the structure of the alveolus, like air goes out, but these this alveolus will not collapse because of the elastic structures, because of the elastic recoils present. But after the loss of the elastic recoils, once the air goes out, the whole structure collapse. And one more thing here is that in all the cases of the obstructive disease, either it is emphysema or either it is chronic bronchitis or whatever it is, in all the types of alveolar, in all the cases of the obstructive diseases, the lungs will appear pale and voluminous. The lungs will be enlarged very much, and they will be obscuring your heart on autopsy. Why is it so? Because as there is obstruction, there is any obstruction due to which air cannot go out, and your lungs are hyperinflated. In this case, air cannot go out, air is present there, so hyperinflation of the lungs is seen in this case. In this picture, bullous emphysema are shown. Bullous emphysema means the formation of bullae under the pleura. Subpleural blebs or bullae are shown here, and we can say that this is the case of the distal emphysema. As in the case of the distal emphysema, the striking appearance of the distal acinar emphysema occurs near the or adjacent to the pleura. One more feature is that we call the people with emphysema, we call them pink puffers, because here one feature that is very much prominent is dyspnea here, as dyspnea means the shortness of the breath. This is the most prominent feature and also the first symptom in this case. So when the patient is dyspneic, it means the respiratory patient is short of breath. The respiratory drive of that person will increase. Due to increased respiratory drive, oxygen will come in, that person will hyperventilate, oxygen will come inside and the carbon dioxide will go outside. And due to this reason, as oxygen is coming inside in very large amount in this patient and carbon dioxide is going outside, and the person is inhaling very rapidly, so the person's appearance will be just pink. So he is called pink puffer as compared to blue blotters, as in the case of the chronic bronchitis, where there is no increased respiratory drive due to which carbon dioxide is retained and the person's appearance is just blue. So we call the patients of chronic bronchitis as blue blotters. That was all. Thank you very much.